Hello friends, welcome to the channel Dewdear Academy. In this video I am discussing the staff nurse question paper, staff nurse 2010 examination question paper, which is conducted in Sri Chitra Tirunal Institute for Medical Sciences and Technology. So here I will be discussing the 10 questions and the answers of it. So it was the exam was conducted on 28/11/2010 and the duration of the exam was 90 minutes and the total marks was out of 80. So let me start the question discussion. So the first question is, percentage of oxygen delivered by use of a non-rebreathing mask with a flow rate of 10 liters per minute is. Percentage of oxygen delivered by use of a non-rebreathing mask with a flow rate of 10 liters per minute is. Options are 20 to 35, then 35 to 50, 50 to 60, 90 to 95. So how much percentage of oxygen is delivered by use of a non-rebreathing mask with flow rate of 10 liters per minute? So here the correct answer is option D, that is 90 to 95. 90, option D is the correct answer, that is 90 to 95% of oxygen is delivered using non-rebreathing mask with a flow rate of 10 liters per minute. Then second question, simple or typical febrile seizures occur in. Simple or typical febrile seizures occur in. Options are infants below 3 months of age, 3 months to 5 years, 3 years to 8 years, pre-adolescence. So febrile seizures are occurring in which age group? That is the question here. So the correct answer is 3 months to 5 years. Option B is the correct answer, that is 3 months to 5 years is the age group in which the typical febrile seizures are occurring. Then the third question, the dilution of adrenaline used in neonatal resuscitation is. Options are 1:10, 1:100, 1:1000, 1:10,000. What is the dilution of adrenaline used in neonatal resuscitation? So in the question here is, how much is the dilution of adrenaline in neonatal resuscitation? So the answer here is 1:10,000. 1:10,000 dilution is used in neonatal resuscitation. The dilution of adrenaline is 1:10,000. So option D is the correct answer. Then question number 4, injection sodium bicarbonate should not be mixed with. Options are normal saline, 5% dextrose, calcium gluconate, ringer lactate. Injection sodium bicarbonate should not be mixed with. Answer is calcium gluconate. Option C, calcium gluconate. Injection sodium bicarbonate should not be mixed with calcium gluconate. Then question number 5. Weight and length of a normal full-term baby with birth weight of 3 kg at 1 year of age are expected to be. So here the question is, what is the weight and length of a normal full-term baby with birth weight of 3 kg at 1 year of age? So if the baby, full-term baby, normal full-term baby with birth weight of 3 kg. So what is now at 1 year of age, what is the weight and length of that baby? Options are 7 kg and 70 centimeter, 9 kg and 75 centimeter, 12 kg and 80 centimeter, 12 kg and 85 centimeter. So here the correct answer is option B is the correct answer. That is 9 kg and 75 centimeter. So if we know the birth weight and we know what is at what happens to the weight and length of the baby at 1 year. So accordingly, what is the answer coming is option B, that is 9 kg and 75 centimeter is the correct answer. So here we know the baby attains 3 times of the birth weight at 1 year of age. So here the question, the weight and length of a normal full-term baby with birth weight of 3 kg at 1 year of age is expected to be. Answer is 9 kg and 75 centimeter. Then next question. Using a placebo for pain control in a certain case without the patient's consent is. Options: justified and ethical, justified but unethical, deceptive but ethical, deceptive and unethical. That is, using a placebo for pain control in a certain case without the patient's consent. So without taking patient's consent for pain control, if the nurse or if the hospital authorities are using a placebo for pain control without the consent of the patient, then what can it be? Whether it can be justified and it is ethical, or it is justified but it is unethical, then deceptive and ethical, deceptive and unethical. So here the correct answer is, it is considered as deceptive and unethical. Option D is the correct answer. It is deceptive and unethical if we are using this example like a placebo for pain control in patient without the consent of the patient. It is considered as deceptive and unethical. Then question number 7. Which of the following can be used for applying moist heat? Options are sitz bath, aqua pad, hot water bag, commercial hot pack. So which is the example for moist heat application? That is the question here. Options given are sitz bath, aqua pad, hot water bag, commercial hot pack. So in this question, the example for moist heat is sitz bath. Option A is the correct answer. Sitz bath is the example for moist heat. So we should study the examples for moist heat and also dry heat, and also the cold application also we should study it, the examples separately. Then question number 8. Which action is most effective in preventing wound infections? Options are using sterile dressings, suggesting dietary supplements, applying antibiotic ointment, observing careful hand hygiene. So these are the options. Which action is most effective in preventing wound infection? Whether it can be using sterile dressings or suggesting dietary supplements, applying antibiotic ointment, observing careful hand hygiene. The most effective in preventing the wound infection is by observing careful hand hygiene. So D is the right answer here. Observing careful hand hygiene is the most effective method in preventing the wound infections. Then question number 9. Before administering enteric coated drug through a nasogastric tube, the nurse should first ensure. Options are crushing of the tablet, flushing the tube with warm water, checking for proper placement of the tube, taking the patient's vital signs. So here the question is, before administering enteric coated drug through nasogastric tube, the nurse should first ensure. So here the correct answer here is checking the proper placement of the tube. That is the most important thing. First we have to make sure whether the tube is properly placed. So checking for the proper placement of the tube is the most important thing before administering anything through this nasogastric tube, rather than giving importance to crushing of the tablet or flushing the tube with warm water or taking patient's vital signs. The most important thing is check proper placement of the tube. Then question number 10. Maslow's hierarchy of basic human needs is useful when planning and implementing nursing care, as it provides a structure for. Options: making accurate nursing diagnosis, establishing priorities of care, communicating concerns more concisely, integrating science into nursing care. So here the question is regarding the Maslow's hierarchy of needs. Maslow's hierarchy. Regarding the Maslow's hierarchy of basic human needs, when planning and implementing nursing care based on this Maslow's hierarchy of basic human needs means it is providing the structure for what? Whether it is to help in making accurate nursing diagnosis, or whether it is helping in establishing the priorities of care, or communicating the concerns more concisely, or integrating the science into nursing care. So we know hierarchy of basic needs. So that is helping in establishing the priorities of care. So option B is the correct answer. It is helping in establishing the priorities of care. So these are the 10 questions in this question paper. SCT, Staff Nurse Examination question paper I have included. And in the upcoming videos I will be including the remaining questions. So thank you all of you for watching this video.